Most people think knee pain starts at the knee itself, but oftentimes it's about the joints above or below the knee that are contributing to your problem. So if you're strength training and you find yourself stiff or painful in the knees, watch this video. We're going to go through a full breakdown of how to assess your lower body mobility in order to make sure that you are optimizing mobility at the hip, knee, and the ankle to make sure you're not having knee pain. So first up, we're going to look at ankle mobility. And you might be wondering, why are we looking at ankle mobility if this is a knee video? Well, as you go into a squat or down a step, if you run out of ankle mobility, you are going to start having your knee cave inward or your foot go outwards. So if you see people coming up onto their toes when they squat or their feet turning out as they squat, that puts a lot of extra pressure on their knees, and it's going to cause some pain and discomfort in the front of the knee over time. The first thing we want to start with is this knee to wall test. For this knee to wall test, I want to see how far I can get this knee away, or my toe away from the wall while still touching my knee to it. So eventually my heel is going to pop up off the ground. So right about there, my heel starts lifting. So I know that is past my limit. I'm going to scoot forward, and that is the sweet spot. So my heel is not off the ground. That's as far as I can get away from me. It's right at the end of this tape. I'm going to mark a line on there. And you want to make sure as you're doing this, your toes aren't going out to the side. Notice how I can probably get another inch past there if my toes go out to the side. So you want your toes to be perpendicular to the wall as you do this test. We're going to measure this distance from that line all the way to the wall. A normal amount of mobility of distance from that foot away from the wall measuring at the toe is 10 to 12 centimeters. So if you are not that far away, or there's a big difference side to side, you should measure and look at both of those, then you're going to want to try this next exercise. But what you want to do is get a band tied around something that's not going to move and get it low down so it's below your ankle bone on the front of your ankle here. You need to make sure your foot is pointed straight forward and not drifting out to the side. And then what I'm going to do is have that ankle in the back, my other ankle in the front, and I'm going to sit towards my heel, get my knee as far over my toes as I can until I feel a nice stretch in the front of that ankle. I'm going to pulse in and out of that position. Notice how I'm not really standing up and down. I'm pulsing back and forth. So my heel is not coming up off the ground, but my ankle is going forward. My knee is going as far over my toes as I can. And every time I get to the end of that pulse, I feel a nice strong stretch in the front of the ankle here. If you feel a little bit in the back, that's okay too. Give this banded ankle mobility exercise a try before you squat next time. See if you're able to get a little bit deeper with less pain in your knee. If this feels a little bit overwhelming as you're going through it, that's okay, you're not alone. The knee joint is a little bit complicated. There's a lot of different areas that have to work well in order for it to function properly. So if you feel overwhelmed or lost, or you're still having pain after going through these tests, I want you to reach out. Sometimes you just need a little bit more of a personalized plan. So our 12-week knee pain plan dives to that root cause of why you are specifically having knee pain and creates a plan around it. So reach out for a free discovery call today. So moving up the chain from the ankle, we're going to actually look at the knee next. There's three main components that we want to look at with the knee. It's, are you able to fully straighten it? Are you able to fully bend it? And do you have the proper rotation? Are you able to fully sit heel towards your butt and not have pain in that knee? Or are you kind of shifting away and not wanting to bend, or is there a gap back here? If there is, you're going to want to try to take a towel and put it behind your knee here, sitting back until you feel a nice stretch in the front, back, and side of that knee, trying to keep your heel towards your butt on that side. And you're going to hold it for about 30 seconds, do 3 or 4 rounds of this. So there's a common misconception that the knee only extends and bends. It actually does rotate about 15 degrees at the end of extension, and you need a little bit of rotation in that shin as you get all the way to that bending position. So if you're running out of room and you feel like you can't touch the calf to the back of your thigh, and you're getting stuck in the bottom of your squats, one of those two things may be an issue, and we're gonna want to look at these tests next. So we're gonna take both fists here in between your knees, and we're gonna see how far you can rotate your shins inward while keeping your toes on the ground. what you're gonna see is this left side is a little bit more limited. I don't get as much rotation, and that is gonna limit how far I can bend my knee when in the bottom of a squat, or how deep I'm gonna be able to get without pinching or discomfort. So if I had difficulty bending that knee during that kneeling test that we just did, or rotating my shin inward, I'm going to take my thumb and hook it behind the back of my knee here and interlock my fingers. I'm gonna be pressing in a counterclockwise direction this way as I go forward with my knee and trying to not let my heel come up off the ground. So I'm really trying to rotate my shin forward and inward as far as possible, but I'm keeping my knee straight in line with my toe. So I don't want my knee coming in like this. I'm pushing it as far forward this way while getting some torque on that shin, going in and out of this position about 15 times. What we're trying to do here is allow improved rotation of this tibia so it can bend further and not get any pinching in the back or front of the knee, and help reduce that pain. You can test your ability to kneel again afterwards, or even get into a deep squat and see if you're able to do that without having that knee pain. The other component to knee mobility is the ability to fully straighten that knee. If you can't straighten that knee when you're walking during push-off, it's gonna create a lack of ability to generate power during running, jumping, and even just with everyday tasks like walking is gonna create some odd forces on that knee, which can create pain. What we wanna do is have your knee flat on the ground like this. You're gonna think about trying to push the back of your knee into the ground. Can you lift your heel up so that there's space under that heel while keeping the back of your knee towards the ground? You can also try to get your heel, your butt, and your back against the wall and see, can you touch your calf to the back of the wall here? If you can touch the back of your knee, great, but at the very least, you should be able to touch your calf to the wall as you straighten that knee. If you are unable to straighten that knee fully, you want to rest your foot up into this position, and the further your foot is away towards the edge of the chair, the more of a stretch you're gonna feel with this. So our goal here is to get a stretch in the back of the knee if you weren't able to fully straighten that knee. You wanna hang in this position for about 10, even up to 30 minutes, and your goal is a total of 60 minutes throughout the day until that knee is able to fully straighten and you can actually do that test that we just did. If you're not feeling much of a stretch here, you can also place like an ankle weight or something small on here that's just a few pounds to add a little bit of pressure. Note you don't want your foot rolling out to the edge, so you want to keep your foot straight up. Hey, real quick, if you're struggling during these, having pain, or you're doing really well with these tests and you're still wondering why your knee hurts, I want you to reach out about our 12-week personalized knee pain plan. That is gonna be tailored specifically to you to find your root cause, not only going through these tests, but other tests as well. Okay, so we're on to hip mobility. If you had good ankle and knee mobility with the tests that we just did, maybe you're feeling pinchiness or inability to get deeper into your squat and you feel like your chest is falling forward. Sometimes that can be due to poor mobility in your hips. So the first thing that we're gonna look at is your hip internal rotation. We're gonna take a foam roller or something of similar size and squeeze between your knees here. And then we're gonna try to see how far you can rotate out here without lifting your hips up off the ground. So you wanna make sure you're staying nice, firm, and planted. You can even pull your hips into the ground here and then go out on either side. You can do both sides at once, and then you can kind of look down and just assess or film yourself. You can see which side I have less mobility on, which is also the side I used to have knee pain on. All right, so what I'm gonna do now, if that hip rotation test was positive, I'm gonna put a band at the very top of my hip at my groin of the side that was tight. Now, I am perpendicular to the band, so this band is straight out to my side. What you're gonna do is, most people make the mistake of just pushing their knee in and they don't feel a lot during this stretch. You're gonna hinge your hip back as if you're doing an RDL or a deadlift. And then I'm gonna push my knee in as I continue to hinge back. Now I feel a strong stretch deep in my groin right in here as I hold this position. I'm gonna hold it for about 30 seconds before I squat or snatch and get into that deep hip position. And then open back up and repeat. Push back in and hold, trying to go a little bit further each rep. So then what we're gonna do is lay down on your back and cross your foot over the top of your knee and see how far can you get this knee down. So you might wanna film yourself or have a partner look, or you can just kind of look up and see how far you're able to go, and then compare that to the other side to see how much hip external rotation you have. So this one is clear that my right side's actually a little bit tighter. If I was tight in that external rotation test that we did where I was crossing my knee over my other side, I'm gonna put this band as high up as I can get it, and then I'm going to let the band kind of pull my hips backwards as I sink into this box. Now, if you're so tight that you can't get your knee down, that's okay. You can start here and just slowly start using your elbow to press that knee down, and over time, work on getting your knee all the way to that box. As this gets better and better, then you can work your way into bending your trunk forward and feel a really strong stretch in the outer hip, and then even through that groin there with the band pulling outward. Hold it for about 30 seconds to improve that hip external rotation mobility. If you found these tests helpful, or if you went through these tests and you didn't really have any problems with them, but you're still having knee pain, I want you to reach out about our personalized knee pain plan. It will get to the root cause of why you specifically are having knee pain. Sometimes you need something more personalized to you, and it's not only going to look at these mobility issues, but also the strength surrounding your knee, ankle, and your hip, and making sure that you are having appropriate mobility and appropriate strength to function at the knee properly and get to that root cause of your problem.